Hi everyone, this is Dr. Corolla Okogbaa coming to you once again with some eye health information. Today we are discussing the word lazy eye. So had someone come in and told me they've had a lazy eye and wanted to know what does that really mean. Okay, so the word lazy eye is more a common term people tend to use when they have like a bad eye or one eye that's just a weak eye. Okay, so the medical term for that really is amblyopia. And amblyopia is when the eye, typically one eye, but it could be both eyes, when one eye doesn't develop the vision well, or the vision doesn't develop properly during childhood. And so that eye remain weak, and that's what we call a lazy eye because it's not really contributing to the vision. Really, you have one main eye that's doing most of the work. Okay, so usually from birth to about 9, 10, both eyes are getting different, they're getting visual stimulation to develop, and you want both eyes to develop equally and properly. But there's certain things that can cause the one eye or both eyes to not develop. What are these things? Well, one is if the child is born cross-eyed, right? Which is, we call it strabismus, okay? Where one eye is focusing at center and the other eye is pointing in a different direction, either inward towards the nose or outward, and we call that strabismus. And so the brain will actually turn the eye that's turned away, it'll turn that off because it does not want to see double vision. And so you have one eye that's weak and it's staying on one side, and then the main eye is staying forward. So we call that strabismus, okay? The other thing that can cause a lazy eye or amblyopia is if one eye has a very, very strong prescription, okay? So we call that refractive error, where one eye is very nearsighted, let's say a -18, and the other eye is great at a -2. Well, once again, the eye is not receiving equal images, and one is very blurry, one is clear, and so again, the brain just really turned one off, and we call that the weak eye or the lazy eye, okay? Other things that can cause that, some people can born with the what we call ptosis or droopy eyelid, right? Some people have both eyelids that are droopy, right, over the vision, or you can have one eyelid that's really droopy, and over time it just causes the eye to not develop well. The vision doesn't develop well because it's basically the eyelid is covering it up, okay? And so it's not getting visual stimulation. And another thing that can cause one eye to not develop well, if you're born with a cataract, we call that congenital cataract, and so obviously that's kind of blocking the vision or the image to get to the brain, and so the brain once again turn that eye off, and thereby now you have a weak eye. And so, and then obviously if you're born with a tumor that's blocking the vision, that's also something that can cause the eye to not develop well, okay? And so those are some of the causes. That's why it's very important that the baby's eyes are checked when they're born, and of course also getting eye exams, because kids cannot tell you that they have one eye that's not working sometimes, right? The child doesn't say. So many times doing their well visits with their pediatrician, they'll get an eye screening. If there's any issues, then they'll send them to see the ophthalmologist to do a full eye exam to see, okay, what's going on. We thought they were seeing fine, but now we're noticing they could see good with one eye. The other eye is not really seeing well, okay? And many kids, for them, that's normal. They've been like that all their life, and so they can't really tell you that there's something different until they get an eye exam. And so that's some of the things that happen. So what do we do for this, right? So the goal is to really catch these things early, right? So we want to catch them early. So sometimes you may see a baby with glasses, right? Or you could see that the child is being patched, and so if the eyes are crossed, sometimes we actually have to do surgery on them real early to get both eyes focusing forward. If there's any what we call refractive error or need for, like, if they're really nearsighted or they have what we call astigmatism or being really, really farsighted, then we'll put then they have to be corrected with glasses or even sometimes contact lenses to give that eye the best chance to develop. Okay. In addition to that, we also have to do something to encourage the weak eye to move and develop, to catch up with the good eye. So many times you'll hear people say, yeah, when I was a kid, I had to patch one eye. And yes, and that's because we patched the good eye. Okay. So now you're blurring up the good eye, and either with patching or sometimes with drops to blur the vision of the good eye so that the weaker eye can try to catch up. You're basically forcing it and encouraging it to get visual stimulation and to work. Okay. And then the child will be monitored. All right. And then there's well, what if the child was never caught, or these issues were never found out while they're in their childhood, and now they're an adult? Is there anything that could be done? Unfortunately, no. Okay. Usually the best time to catch this development of the eye and trying to help it to get better is in that first 10 years, 8 to 10 years of life. Okay. Once you pass that, then the chances of that eye developing as equally as the other side is, your chances is low. And then by the time you get to an adult, that weak eye will still remain as a weak eye or amblyopic eye, or what we say the lazy eye. Okay. Now for some people who develop what we call cross-eyed, or they have strabismus where the two eyes are pointing in different directions, then yes, we can actually do surgery to help straighten them up so they'll look equal, but the vision does not come. So it's more for cosmetic purposes, make the eyes look straight, but the vision itself cannot get corrected at that adult stage. Okay. And so those are some of the things that you'll hear when someone say, I have a lazy eye or I have a weak eye. That's what it means. They have amblyopia. Obviously, we want to catch that in their childhood. And then now, if you're an adult and you have a weak eye, or you have one good eye and one bad eye, very important that you maintain your eye examinations to really protect your good eye, so that it can continue to function well for you. Okay, so that's what I have for you today. We talked about what a lazy eye is, how we catch it, and what we do for it. Okay, and so if you know anyone that may find this information helpful, please send them this video. Or if yourself you have a bad eye or a lazy eye and haven't had your eyes checked in a while, well, come on by, check us out at www.lacenterforeyes.com, or stop by our office in the Baton Rouge area. We'll be happy to take a look at your eyes and make sure everything's going well. Okay, thank you for watching. I'll see you next time.